Okay, let's unpack this. So you've brought some really interesting source material today.
Yeah, it's a new study just out from Finland. And we also have some quotes from the lead expert involved.
Right. And it looks like it tackles a pretty big question.
It does. It's all about how long young people are really using ADHD medication, in day-to-day life.
And how that lines up or doesn't with the safety data we actually have.
Exactly. How long is it safe for? Based on solid evidence.
So that's our mission for this deep dive then. We're going to sort through this research paper, the expert comments.
And really pull out the key findings for you.
Yeah, give you a clear picture of what this study found and, importantly, what it actually means.
Okay, so I guess the headline finding, the really striking thing.
What jumps out?
It's that young people are often staying on ADHD medication for years, not just a short course.
Years, okay. And that matters because why? The safety testing.
Right. Because the most reliable clinical trials, the ones used to, prove safety for regulators, they mostly just track people for 1 year.
Only 1 year.
But this Finnish study, it found the average time kids were on the medication was over 3 years.
Over 3 years on average. Wow, okay. So that's already way past that 1 year safety window from the trials.
It is. And it gets even more stark when you look at the longer-term users.
Okay.
For a pretty big chunk of them, the quarter of the kids who were on it the longest, they were using it for more than 7 years.
More than 7 years for a quarter of them.
Yeah.
So average over 3, a quarter over 7. But the solid, reliable safety picture is just for year 1. That sounds like a huge gap.
It really is. A big gap in understanding, especially, we're talking about kids, children, and teens who are still developing.
Yeah, their brains and bodies are still changing so much.
And the lead researcher, Päivi Ruokoniemi, she specifically points this out. She calls it an important research opening.
Because we just haven't studied this long-term, real-world use enough.
Exactly. She said it's been studied to a very limited extent.
And she expressed concern, didn't she, about that mismatch between duration and data?
Yes, absolutely. She highlighted the worry that, reliable safety data is only there for up to a year, while these kids are at a sensitive stage of development.
It's that specific contrast, the sensitive stage and the limited data that really makes you pause.
It definitely does. And the study went further, too. It didn't just look at how long, but also tried to see who tends to stay on medication the longest.
Oh, interesting. So, what factors predict longer use?
Yeah. They found 2 big ones, gender and the age the child actually starts the medication.
Okay, let's take gender first. What did they find there?
Well, on average, boys stayed on ADHD treatment longer than girls did.
Longer by how much?
Just over a year longer, on average, across the whole group they studied.
Okay. And what about the starting age? Does starting younger mean you stay on it longer?
That seems to be the case. The data showed pretty clearly, for both boys and girls, that starting the medication earlier was linked to a longer time taking it overall.
So putting those together, are we talking about young boys having the longest duration?
That's exactly what the study highlights. The group with the longest median duration? Boys who started between 6 and 8 years old.
6 to 8. Wow, so really early elementary school years.
Right. And for that group, the median time on medication was 6.3 years.
6.3 years median, so half were on it even longer than that.
Yes. And get this. For a quarter of those boys, the ones starting age 6 to 8, treatment lasted for more than 9.4 years.
Nearly 10 years. For 1 out of 4 in that young starting boy group.
Yeah.
And was this a tiny fraction of the people in the study or a common scenario?
No, not tiny at all. That group boys starting age 6 to 8 was actually the biggest single group in the whole study.
Really? How big?
They made up nearly a third, 32.4% of all the kids and teens included, almost 41,000 subjects in total.
Okay, so the largest group starts young, stays on longest, many potentially for their entire basic schooling, 9 or 10 years. And that brings us right back to the experts' concern, right? That 1 year of reliable safety data just doesn't cover this reality.
Exactly. It really underscores that disconnect between the clinical trial evidence and what's happening in practice.
Okay, so we've established this gap. The real-world use often stretches years beyond the typical 1-year clinical trial data. Let's dig into why that research picture looks the way it does. Why only 1 year for the best data?
Well, the gold standard is those randomized controlled trials, or RCTs. They're designed specifically to isolate the effect of the drug, cause and effect.
Right, the most rigorous kind.
Yes. And for getting a drug approved in Europe, the European Medicines Agency usually requires clinical safety data from those trials that covers at least 1 year of follow-up.
So 1 year is the benchmark they need to hit for regulatory approval. But surely there are other studies that look longer, observational ones maybe?
Oh, absolutely. There are other kinds of studies, like observational studies or ones without a control group, that have tracked people for longer periods.
But they aren't as reliable.
Well, the expert quote in the source material puts it nicely. These studies are prone to confounding.
Confounding, meaning?
Meaning it's hard to separate the effect of the medicine from, well, everything else going on in a person's life.
Like other health issues, family situations, school support.
Exactly. All those other variables that aren't controlled. So while these studies can show associations like kids on meds longer also had X outcome, they, according to the expert, do not provide reliable information on cause and effect relationships.
Got it. So they can show patterns, but they can't definitively prove the medication caused a long-term benefit or harm because too many other factors might be involved.
Precisely. Which leaves us relying on those 1-year RCTs for the most solid cause and effect safety info.
And this Finnish study we're discussing, just to be clear, it wasn't one of those RCTs, right? It was different.
That's correct. It was what's called a descriptive register study. They used anonymized data from Finland's national health insurance system.
So looking at real-world prescription data.
Yes, from 2008 up to 2019. It's a huge data set, nearly 41,000 kids and young people who started ADHD meds during that time.
Wow, that is a lot of people. Gives a really broad view.
It does, and it was published recently in European Child and Adolescent Psychiatry.
So using that big data set, what did they find about just how common ADHD medication use was in Finland during that period up to 2019?
Well, in 2019, which was the last year they looked at, the prevalence, the percentage of kids using the medication was around 5 to 6% for boys.
Okay.
And about 1.3 to 1.5% for girls.
And did they note any trends over time?
Yeah, they mentioned that medication use has been going up pretty much everywhere globally, but it's been rising particularly fast in Finland.
And hasn't that trend accelerated even more since their data finished in 2019? I think the expert commented on that.
Yes, she did. Päivi Ruokoniemi specifically stated that the proportion of Finnish kids and teens using these meds has basically doubled just in the few years since 2019.
Doubled since 2019, on top of the long durations they already found. That's quite something.
It's a very rapid increase, yeah.
Okay, so let's summarize where we are. We have kids, especially boys, starting young, often staying on meds for many years, well past the solid 1-year safety data. And the number of kids starting these meds is climbing fast. Given all that, what do the researchers actually recommend? What should be done?
Based on their findings and, acknowledging these uncertainties, they have a few key recommendations.
Like what?
First, they really stress that medication shouldn't be the first resort. It should only be started after non-drug options, like therapies and support, have been tried and aren't enough on their own.
So prioritize behavioral and other supports first. Makes sense. What else?
Second, and this ties right back to the data gap, they say it's crucial that parents, caregivers, and the child too, depending on their age, of course, get sufficient information.
Sufficient information about what exactly?
About the expected benefits, yes, but also the potential harms and the uncertainties. People need to understand what's known about long-term use and, critically, what isn't known.
Full transparency, but the evidence gaps.
Exactly.
Yeah.
And their third main point is about ongoing use.
Okay.
They recommend that if medication is started, the need for it should be reviewed formally by a doctor every single year.
An annual check-in to see if it's still needed, still working, still the right approach.
Right. A regular reassessment. These all seem like pretty practical steps, given the study's findings about long duration and limited long-term data.
Okay, so let's just quickly recap this deep dive for everyone listening. We looked at this really important Finnish study.
Which basically shows a big disconnect.
Mm-hmm.
Kids and teens are often on ADHD meds for years, sometimes, close to a decade.
While our most solid safety data from rigorous trials really only covers that first year.
Right. It's a significant gap between real-world practice and the evidence base.
So hopefully, by digging into this research with us, you've got a better handle on these complexities. Understanding medication use over the long haul, especially when kids are still growing and developing.
It's definitely a complex picture.
And maybe here's something to leave you thinking about, something directly from the source material we discussed. We heard that the number of young people using ADHD medication in Finland has actually doubled just since 2019, when this study's data collection ended.
Yeah, building on a situation where average use was already 3 years and many were using it much longer.
So with that rate of increase, and knowing the average duration is already pushing way beyond that 1 year of solid safety data,
Yeah.
what might this ongoing trend mean for truly understanding the long-term effects down the road? Something for you to mull over.